Variable hour employees and the Affordable Care Act is a really challenging area for those employers that do have variable hour employees. And variable hour employees are those employees that are working less than 30 hours a week, and they tend to do so either on a seasonal basis or they're just always part-time folks. The Affordable Care Act requires that employers actually look at that employee population, that variable hour seasonal employee population, and basically account for it. They use the accounting is done for two reasons. One, to basically determine whether an employer is a large employer that is basically subject to the full brunt of the Affordable Care Act, or and if they are, then basically those employees have to be tracked in terms of their eligibility for health insurance that the employer may or may not have to pay. And there are all sorts of different complex formulas and things that decisions that have to be made on the part of employer about the best way to minimize that effect of providing coverage to those variable hour employees. And it's a very important part of the analysis that we do for those clients. Yeah, employers that have variable hour employees know so. They've probably gone to a couple webinars and talked to their attorneys about it. And the first thing that they need to do is figure out the system that they're going to track the hours in, and basically defining who are their employees. Is this temp person really an employee or not an employee? And then develop a tracking system, which means usually part of a payroll system to track those hours. And then once you do that, then the employer needs to figure out kind of what's the best approach in terms of these complex rules, in terms of look-back periods and measurement periods and that type of thing. And once they figure out, it's not too difficult. Once you figure out the best way going forward, then you have to continue to monitor your variable hour folks to see who's coming into eligibility for health care insurance, who's going out that you don't have to make the offer to anymore. And then you have to decide what level of coverage you want to offer.